action.
Come in.
Hi, are you Ebony?
Yes.
Hey, my name's Elizabeth.
Hi.
I'm one of
Nice
the
to meet you.
pharmacists that works here at the clinic. How are you today?
I'm doing well.
Good. So today we have you in to get your blood pressure taken.
Yes.
That's not correct? So typically when we take blood pressure, we'll just wrap the cup around your upper arm, and then we'll pump it up with air, and we're able to get the blood pressure reading. Are you okay with me doing that today?
Yeah, that's
Okay,
fine.
awesome. So before we get started, I just have a few questions to ask you. The first one is, have you ever been told you have high blood pressure?
No.
Never? Okay. And then what is your usual blood pressure reading?
I haven't had one in a long time, but I think I'm around like 120 over 70.
120 over 70? Okay.
Yeah.
And then what medications do you take?
I'm not on anything. Sometimes I like to take an oral supplement over the counter, like a multivitamin.
Okay.
But besides that, no.
Okay. So an over-the-counter multivitamin. Have you exercised within the past 30 minutes?
No.
No? Okay. Have you had any caffeine within the past 30 minutes? So like coffee, tea, soda, nothing like
No.
that? Okay. And then have you smoked or had any tobacco products
Oh,
within
I
the
don't
past
smoke.
30 minutes?
That's fine.
You don't smoke? Okay. All right. And then have you had any surgeries on your upper arms or chest recently or
No.
ever?
No.
No? Okay. Any injuries to your upper arms?
No. No.
Okay. And then I don't see any, but do you have any IVs in either arm? No IVs? Okay.
No IVs.
All right. Well, then we're ready to get started, but we'll just have you sit quietly for about 5 minutes. So our patient has been sitting quietly for the past 5 minutes. So Avni, if you wouldn't mind making sure your back is flat against the back of the chair, your legs are uncrossed, and your feet are flat on the floor. And then if you also wouldn't mind rolling up your sleeve, that's okay. And then placing your arm on the table so that your upper arm is the midline and in line with your heart. So then the next part is picking the appropriate cuff size. So the easiest way to do it is looking at the range and making sure that the index matches up within the range. So for this child cuff, if we looked at it, see that it's obviously going to be too small. But if we look at the adult cuff, matching up within the range, we'll see that it fits. See that the index line fits within our range. So before putting on the blood pressure cuff, find the brachial. After placing the cuff on, just want to make sure it's not too tight for the patient. You can also double check by putting fingers underneath. So 2 fingers underneath the cuff, and then making sure it's just somewhere in the... So after we've chosen the appropriate cuff, the next step is to find the radial pulse using our index and middle fingers. And after you've found the radial pulse, so you have 2 options. You can either ask the patient to hold this, or you can stick it actually on the cuff. A lot of them have a little thing where you can stick it on so that you're able to see the pressure after you pump up. So you find the radial pulse again. You make sure you tighten this. Make sure I tighten it on. And then you... Let's see. Okay. So you tighten it, then you pump up until you can't feel the radial pulse anymore. And even after that, you'll go a little bit higher, and then you'll slowly release. Until you can feel the radial pulse. Okay. So that was somewhere around 114. Okay, so after the patient, we've gotten the palpable systolic, we have the patient sit quietly for 1 minute, and then we're ready to take the blood pressure. So when you use your stethoscope, you want to make sure that the actual little ear thingy-mabobbers are going forward. You can use the diaphragm or the other side. Essentially though, you want to stick it where you know that brachial artery is. And then at this point, you're able to, you want to tighten and then pump up 20 to 30 millimeters of mercury past that palpable systolic. So you'll pump up 20 to 30 millimeters of mercury past the palpable systolic, and then you'll slowly let the air out at 2 to 3 millimeters of mercury. And you want to make sure that you go down 10 millimeters of mercury further after that last Karate cough sound, just because you want to make sure you don't miss anything. So Avani's blood pressure was somewhere around 112 over 76. So I know that's less than 120 over 80, so I wouldn't have to have her see a preceptor. All right, so Avani, so your blood pressure, like we had talked about, so it was under 120 over 80. So if we were at a health fair, I would not have to find a preceptor to come talk to you. So that's great. Just to close out the session, I have a couple more questions to ask. So what is your usual diet?
So I'm a vegetarian, so it's really varied, but I do eat a lot of vegetables. I do eat a lot of different lentils and soup. I do eat tortillas, so some carbs.
So it sounds like
and
overall it sounds like you're doing a pretty good job with your diet. So high in fruits and vegetables. Important to make sure you're incorporating some form of protein, and carbs are okay in moderation. So great. And then what exercise are you currently doing?
You know, I haven't had a chance to exercise lately. I'd like to get back on track with that. Do you have any recommendations?
You know, I think usually if you're not exercising, maybe one thing you can do, or one thing I typically will recommend is just try to kind of start. So maybe even doing like 10 minutes, like 3 or 4, maybe even 5 times a week, and kind of building up from there. But you know, the more you're able to incorporate physical activity into your daily routine, the better long-term outcomes you're going to have. So you're going to be less likely to have high blood pressure, heart attack, things like that. Last question, how is your stress level?
At the moment, it's relatively low, but it can fluctuate.
Well, it's great that it's low. And when you are having like those high stress moments, just try to find something that kind of takes you out of that moment. Maybe meditation, exercise is actually a great way to help with stress. So it's almost like killing 2 birds with 1 stone. But all right, if you don't have any other questions, I'll let you go. Nice to meet you.
Thank you.